When I was in middle school, I volunteered at Montclair Nursing Home. At the time, I had a great-grandma who was 95 years old and living at the same home. Every day I volunteered, I got to see her and say hi. I volunteered for about 3 years, and by the time I stopped, I barely recognized who she was. A woman who loved to go on walks, read the paper, and finish the jumble each and every day. She had completely changed. She couldn't move and was laid up in bed 24/7. She couldn't feed herself, and eventually was so weak, she was hooked up to a feeding tube. I remember the grief it caused my family. My dad, his brothers, their mother. Whenever I saw her with her eyes open, I could see the obvious pain she was in. I remember overhearing discussions of what to do with her, but I never understood. But being so young, I never understood what they meant. At 98, she passed, and to this day, I still do not know if it was natural or the decisions of someone else. I do know that she is now at peace and doing much better than she was in that hospital bed. When examining passive voluntary euthanasia versus active voluntary euthanasia, the two are so similar in actions, motives, and the end result that the remaining 47 states should legalize active voluntary euthanasia as Oregon, Washington, and Montana have done so. What is euthanasia? According to the Life and Hope Network, it is the act or practice of ending the life of a person either by lethal injection or the suspension of medical treatment. What is voluntary euthanasia? Voluntary euthanasia is conducted with the consent of the patient. Voluntary euthanasia can be broken down into two separate variants, passive and active. Passive voluntary euthanasia is a removal of the feeding tube, allowing the patient to slowly die, or not taking the necessary measures to maintain life. Active euthanasia is the process of ending someone's life by the use of drugs. For example, overdosing on morphine, which causes a painless and quick death. Currently, passive euthanasia is legal in all the U.S., and active is not. Active voluntary euthanasia is viewed as murder in most people's eyes, and currently is one of the biggest debates going on in our country. Those against active voluntary euthanasia stand behind four main arguments. First argument is that there are alternatives to active voluntary euthanasia. One of the main alternatives is passive voluntary euthanasia. This may not be the best option. According to Examiner.com, these procedures have shown to deteriorate a person's personality and self-worth, without which life feels meaningless. About a week ago, I sat down with my uncle, who is a hospice nurse here in Denver. A hospice nurse, for those of you that don't know, deals with patients that are going to die within a few months. He told me a story of one of his most recent patients who was hooked up to a feeding tube for about a month. After that month of being hooked up, he went up to her son and told him that eventually her body would start denying the supplements that the feeding tube was giving her. The son didn't believe him and said, keep her on and let her keep living. About 2 or 3 days later, her body did exactly what he told her. She started bloating and the food just wasn't going anywhere. After realizing that my uncle was right, her son immediately told him to disconnect the tube and let her pass. Human values trump the will to live. Do you believe in a death with dignity? The second argument is that the distinction between passive and active voluntary euthanasia is morally significant. Morals are based off a person's standards and what they feel is right or wrong. Morals can differ. This brings up the doctrine of double effect. As St. Mary's.edu states, this principle aims to provide specific guidelines for determining when it is morally permissible to perform an action in pursuit of a good end, in full knowledge that the action will also bring about bad results. Where is the fine line? If two actions bring about the same result, why not choose one with less suffering, death with dignity? Third argument: not all deaths are painful, and without pain, and without pain present, death is unethical. As Examiner.com says, the fact is that everyone's going to die. The only question that remains to be answered is when, how, and under what conditions. People deserve the right to make their own choice. If death is inevitable, why make the person lay in a hospital bed waiting for it? Life and Hope Network states that all the patients who requested assisted suicide cited psychological and social concerns as their primary reason. Once again, this brings up the idea of a death with dignity. Fourth and final argument. Legalizing active voluntary euthanasia will lead to unacceptable consequences. Life and Hope Network states that although numerous studies in Netherlands and elsewhere report a failure rate of up to 25%, Oregon has yet to report even one complication in over 4 years. Two worries are that people would abuse the system for suicide, and that doctors may commit unwanted murder. To avoid these two things, a regulated system would have to be put into effect. This would make it nearly impossible for any of the above to happen, and it would set a clear boundary between euthanasia and murder. Doctors would be forced to strictly uphold the boundary in order to not lose the practice. Besides voluntary euthanasia, there are two other sides to euthanasia: involuntary and non-voluntary. In most situations, the two are murder, and I'm not promoting the legalization of those. But in the case of non-voluntary, where a person is in a coma or vegetative state, a living will should be accepted as voluntary euthanasia. When you take a close look at passive and active voluntary euthanasia, the two have the same result, which is caused by the doctor's actions. In one case, the doctor is starving someone to death by removing their food source. The other, the doctor is welcoming death in a peaceful and quick way. People deserve to make their own choice, and we as a family or a community should accept their decision. Sometimes people feel like they are a burden on their family and friends, and when death is near and unavoidable, such a person may decide to stop the pain that they are causing themselves and their family. Although we never want to lose someone to death, when it is inevitable and when the will to live is gone, that person should be able to make their own choice on how to go.